WISC-TV now presents For the Record. The city responds to its overdose crisis. That's next on For the Record. Thanks for joining us. I'm Neil Heinen. The story a week or so ago had a Madison police official called the staggering jump in opioid overdoses and deaths in Madison a public health crisis. I did a couple of editorials drawing attention to the issue and repeating a theme I've heard more and more, that we're just not doing enough to prevent and treat opioid addiction. Mayor Soglin called me to suggest citizens don't know how much the city is doing to battle this problem, and I think he's right. So what is the city doing? My guests this morning are the people to tell us, and I welcome to For the Record Dane County and Madison Public Health Supervisor Julia Olsen and Skye Tikkanen, Drug Poisoning Prevention Program Manager for Safe Communities, Madison and Dane County. And thank you both very much for joining me.
Thank you.
How do we, how do we begin to describe this issue, Julia, just from a public health perspective, from Dane County Madison Public Health, when you're in your office talking to your colleagues about this issue, how do you position it?
How do we position it? Well, I think, we're obviously very concerned that we're seeing overdose deaths increase. We're concerned about all the things that go into that and the rise in heroin and synthetics and now cocaine. And if you look to the north, in northern Wisconsin, we're starting to see meth come in more. So we always know that the particular drug we're dealing with is going to change, but there are some things that we know, no matter what the drug is or the topic we happen to be dealing with at the time, that there are these shared risk factors that we can be addressing to prevent issues. And what I think we'd really like to see is more emphasis put on prevention and how do we be proactive. Sure. I think as a city and as a county and all the different organizations in our community and treatment providers who are working to fight this issue, we all understand that we really feel like we're being very reactive, and where we'd like to be is in a space of being more proactive and thinking about how do we prevent from a young age and how do we enforce prevention and reduce risk, again, from a young age through the college age, through midlife, across the life course. And there's different things we can do, but it really does take a community-wide approach to reinforce those protective factors and reduce risk across the life course.
We always, we want to tell it like it is. We want to say what the problem is, and yet there's always some risk in using words like crisis and epidemic. Is that fair?
I think so. For the public health world, and the way our brains are trained, crisis means certain things to us and responses, but I think it's fair to call this a public health crisis. People are dying, and that's not something that we take lightly. We know that there's more that needs to be done, and I think, all of us in our organization and with our community partners are doing a lot to think about how do we collaborate, how do we build on all of the things that we're doing to make a more comprehensive approach where we can be providing supports, from prevention to treatment to recovery in a more comprehensive way.
Skye, Safe Communities has identified this as an issue for some time now. I wasn't part of I don't remember it being part of the conversation in a big way 20 years ago.
Absolutely.
When Safe Communities started. But in the last 7-8 years, it has certainly been a focus. And it's been, I think, put in the context of drug overdoses, accidental drug overdoses. Talk about Safe Communities' perspective on this.
So Safe Communities is funded through a county and city partnership to just really tackle the opioid crisis in our community. The way that we've gone about it is that it's a complex problem, which means that it needs complex solutions. We've coordinated with a number of different stakeholders. I believe we have 175 stakeholder partners working on this with us.
These are different organizations, different municipalities. Yeah.
Exactly.
Yeah. The state. There's.
Yeah. We need everybody on board because this is something that impacts everybody. If you don't know somebody who has been impacted by the opioid epidemic, then you're probably living under a rock.
Yep. Right.
So, the way that we've gone about it is that we really wanted to target a couple of different things. The first thing that we wanted to target was decreasing death, right? So increased access to naloxone, increased access to treatment, and making sure that people know that they can call 911 and they have that limited immunity under the Good Samaritan 911 law.
Naloxone or Narcan is a drug that's administered that reverses the overdose.
Exactly. Yeah. The next priority that we had was stopping the flow. So I think that a lot of what I saw as a therapist on the front lines of this was that it became okay to use heroin in high school. It became socially acceptable for that to happen. And the way that happened was that, people were taking pills. They were prescribed by a doctor. They thought they were safe. The pills got really expensive. They would switch to heroin. And all of a sudden, the social dynamics in high school changed where that was not something that was looked down upon. The great news is that it is again now. So we've really worked to educate the public about the risks of prescribed medication. And then we've also worked with prescribers. All of the healthcare organizations in Dane County come together once a quarter on our healthcare task force and talk about the best ways, the best evidence-based practices to increase safe prescribing and reduce addiction and adverse drug effects. So really cool stuff going on there. The last part of our efforts is really around treatment. Treatment is expensive, so it's a hard priority to get a lot of traction on. But the way that we've gone about it is really trying to unify the treatment system. We have a number of really amazing treatment providers in Dane County. The problem that we see is that it's so difficult to navigate the system because different funders connect with different treatment agencies, depending on your gender, if you are a minor or an adult, your need for medication-assisted treatment, all these different factors. There's a good chance that you're going to call the first couple treatment centers that you call aren't going to be able to work with you. And we were losing people at that point. They would make those couple of phone calls and then they would get discouraged and they would be back out using. We're really looking to try to bring the system together so that people can get help exactly when they need it.
I would like to expand on all of that. And we're going to do that when we come back on For the Record right after this.
For the Record, sponsored by MG&E, your community energy company.
For well over a decade, WISC TV3 and Channel 3000 have paid tribute to top-notch teachers nominated by our viewers. Every month, we spotlight and salute an area teacher, and we want to hear about your favorite. If you know a teacher who deserves to be recognized as a top-notch teacher, send us a letter, an email, or nominate a teacher at channel3000.com.
Top-notch teachers, sponsored by Lazy Boy Furniture Galleries and by Concordia University.
Spectrum is redefining everything you thought you knew about internet, TV, and voice services to bring you the ultimate triple play. Introducing a true revolution in internet speed with game-changing new starting speeds of 200 megabits. That's double our previous speed and double the bandwidth for the fastest surfing, streaming, gaming, and more. Get Spectrum Internet starting at 200 megabits for $29.99 a month with no data caps and a free modem. Call 844-419-2999. Then catch all your favorites in stunning HD, plus thousands of titles free on demand with Spectrum TV for $29.99 a month. And get Spectrum Voice with unlimited calling to the U.S., Mexico, and more for $29.99 a month. Call 844-419-2999. Switch to Spectrum Internet TV and Voice for $29.99 a month each with no contracts. Call 844-419-2999.
On the next Live at 4, we'll meet the new CEO of the Overture Center and find out her vision of the future.
And sweet corn is at its height of the season. Our Donna Weihoffen has some great recipes for us.
Away from your TV, News 3 is constantly providing breaking news, weather alerts, and updated information on all your favorite social media sites. Follow friend. Subscribe. News 3. We're always on.
Madison has had a recent 3-month window where the number of opioid overdoses, the numbers just jumped, and there were an increase in the number of deaths as well. And it's attracted a great deal of attention, and we are talking about the city's response to that on For the Record this morning with Julia Olsen with Madison-Dane County Health and Skye Tikkanen from Safe Communities, both experts in this area. And before, I just want to finish the piece on the most recent period of time, because it was headlines there for a while. 3 months, the numbers were dramatically up from the same period a year earlier. There was some conversation about why that was. What can you tell us, Julia, about it?
Yeah, what I can say is it's certainly alarming to us. We do know that we are seeing fentanyl be more present lately in overdoses that we've seen over the past year, and what that means is that we have just greater potential that an overdose is going to be fatal. It takes more naloxone to save somebody when fentanyl is mixed in with what they've been taking than it would if, say, it wasn't present. Not everyone is equipped with naloxone on the scene, so again, a family member might have naloxone, but they might need more doses than they actually have present. Usually a pack includes 2. I've seen situations where 3 and 4 is what you might need to revive someone if fentanyl's on board.
There was a story just this past week where a police officer needed 4 doses of naloxone to bring back someone who had overdosed.
Yes, and we're seeing an increase in things like cocaine. For us at Public Health, part of what we've tried to do is figure out where are we seeing these overdoses, both fatal and non-fatal. How do we hone in on a response in those areas? For example, we see a great deal of overdoses that happen in public places. So how do we do outreach to business to make sure that those employees are trained, they know how to recognize signs, they know how to administer naloxone? So we've started that. We've produced a video to help educate on the signs of an overdose and to explain to people what you would need to do. There's a lot of individual trainings that are being done with Safe Communities and the AIDS Resource Center of Wisconsin, and this is just another opportunity to get that message out to a larger audience. So we're using that as an opportunity, and one strategy we're trying to work on, trying to see how we might be able to get funding to do actual training with businesses in these areas that are experiencing a lot of overdoses in these public places like libraries, whatnot, restaurants, gas stations, and to make sure that they have naloxone in their first aid kits. We want them to be calling 911 and want them to be calling for help, but seconds and minutes can make a difference in whether someone lives or dies.
It seems like it's important to me that we acknowledge that this that there's a difference between something like fentanyl and its role in overdoses and more people using. That if it's the same population, but they're having more overdoses because the drugs that they're using is smaller, as opposed to a constantly increasing number of people. Do you have any sense of that,
So
Skye?
there's some actually really good national data on that. We're seeing the lowest number of initiates in teenagers for opioid use in like 2 decades.
Okay.
Right.
Positive news.
Absolutely. Yeah. And then we're also, I read another study by Duke recently that shows that there's actually less people that are struggling with an opioid use disorder, but their risk of death is so much greater because of fentanyl. And that really matches, and I'm a person in recovery, I'm a part of the recovery community, a therapist, and then I work at Safe Communities, and so that really matches, anecdotally what I'm seeing. But as a person in the recovery community, I have to tell you that we are scared because those people who are relapsing and who are using currently are at such high risk for death.
Does that change the approach that the recovery community takes to helping these folks?
It does. We've never dealt with anything this deadly before in the recovery community, and so we really do. We're trying to, we've always come from the idea that like relapse is a part of recovery. It's not a failure. You can get right back into recovery. We're there to support you. And now it's a lot scarier because that one relapse could mean that person dies. So it's a balancing act right now, and it really is. It's hard to figure out what to do on that personal level, and on the professional level, and then on the community level.
And even getting right back into intervention, Julia. I mean, we know treatment works. There are so many examples of treatment that works, and the best prevention is to get people into treatment and keep them from wanting to use it. And yet we keep hearing about barriers to getting into treatment. How can we get better at this?
Well, part of what we're trying to do at Public Health is work on what are those systems barriers. Skye has talked a bit about some of the ones we face on the treatment side, but there are huge barriers we also face on just being able to do large-scale prevention activities. We do know, we have research on a number of different programs that are effective. They cost a lot of money to do it well and wide scale in a community, and I think one barrier you often have is, it's difficult to show what didn't happen sometimes, which is something we faced. I'm a preventionist at heart. That's what I've done for a lot of my career, is work on the prevention side, and being able to have that kind of effort can be really hard to do wide scale, or being able to intervene at the best moments. Sometimes it can be simple things like, screening questions within a health system when you're going to see your primary care doctor, but that's still also assuming that you're seeing a primary care doctor. So again, with the health department, we've been trying to work on policy change, systems change, and also look at this issue from a health and racial equity lens and think about what communities are being disproportionately impacted, how can we address that, and doing those types of reviews on any new strategy we put forward.
This kind of smacks of stigma, though, because if we don't get breast cancer, we celebrate that. And we think prevention is great. If we don't get colon cancer, we say prevention efforts work. And yet with opioids, we don't have the same relationship.
I can say that there's been a lot of progress that I've seen made. I've always been very open about being in recovery, and it used to be that people would come up to me after I would announce that I was in recovery and be like, "That's so brave. I don't think you want people to know that. I think you should probably keep that to yourself." And now it's just a normal conversation. We do a lot of anti-stigma trainings at Safe Communities, with healthcare, with probation, with police, kind of all across the board, because we're people, and we deserve treatment. We deserve to have quality lives. We deserve the same rights that anybody else has. And when you invest in somebody's recovery, they invest in your community. They become a taxpayer. They are a positive part of your community.
I think that point cannot be overemphasized, who we are. And I'd like to talk about that a little bit more when we come back and For the Record after this.
Congratulations to Sasha Viviano, a top-notch martial arts teacher at Infinity Martial Arts in Middleton.
I learned so much as a young person in martial arts. Now it's my turn to share with everybody else my passion for this sport.
If you know a teacher who deserves to be recognized as a top-notch teacher, send us a letter, an email, or nominate a teacher at channel3000.com.
Sponsored by Lazy Boy Furniture Galleries and by Concordia University.
This is an exciting time in the energy industry.
The world is changing, and we want to work toward common goals.
Toward a cleaner energy future, driven by innovation, powered by working together.
By working with customers, we provide customers what they want.
MG&E is your community energy company for the future, powering our community, sharing your values, partnering to meet your needs. Visit energy2030together.com to create a more sustainable future together.
We have a long way to go on healthcare. We do. Wisconsin was a leader at one time in expanding access to healthcare, and we can be again. I'm Kelda Royce. When I was in the legislature, we strengthened Badger Care, and at the end of that long process, about 80,000 more Wisconsinites had access to great healthcare. We need to make sure that healthcare is universally available and that everyone can buy into a great plan like Badger Care at an affordable cost. And the good news is we have that within our grasp. We can do that.
Most of us take it for granted.
Without water, we cannot live.
How a local church group helped bring clean water to a Honduran village.
You will always be in our hearts.
A life-changing mission. Monday on News 3 at 10.
I'm back with Madison-Dane County Public Health Supervisor Julia Olsen and Skye Tikkanen, who is the Drug Poisoning Prevention Program Manager for Safe Communities, Madison-Dane County. You were talking about being in recovery, Skye, and it just, it reminds me that I don't think people have a clear picture who we're talking about. And it is, as you say, everybody knows somebody.
Absolutely.
But that also reinforces that these are people in our families that we work with who are struggling with this.
Yeah. I mean, substance use disorders don't target a specific group. They're all the way across our community. There's opioid use disorders are impacting the elderly population. They're impacting the LGBTQ population. They're impacting the African American population, the Latinx population. They're everywhere. And if you aren't noticing them, one of the things that the recovery community we did to protect ourselves was that we decided to be anonymous. And for me personally, I've decided to not be anonymous anymore, because if all you see is us getting arrested or committing crimes or whatever it may be, and you don't see the people like me that are living in recovery, that are a positive part of your community, it really does lend to that stigma that, we're not valuable people.
Yeah, and from a Dane County perspective, Julie, I'm always struck by, because it seems disproportionate in rural communities, small towns, where opioid use can just really disrupt a whole town.
Yeah, it's definitely true. Again, I came here from Indiana, where we have evidence and have seen whole cities, whole towns and rural communities be completely decimated by heroin and opioids and prescription drugs. And here in Dane County, again, a lot of focus happens on Madison, but we also remember that just because an overdose occurs maybe within the city limits, that doesn't mean that these aren't individuals that live other places in our community. And we always remind ourselves that these are our friends, these are our families, these are our community members, who are all struggling with this issue. And again, it's happening in rural areas, it's happening in all areas of Dane County. It's Sun Prairie, it's Verona, it's Middleton. There's no area where we're not seeing some sort of an impact.
And recognizing that this is a public health issue, and then how we phrase our conversation around it. The police officer intervention that I talked about, one of the headlines I saw focused on the arrest of the two people involved. And so this idea of positioning this issue as a crime rather than a public health has got to be complicating.
Definitely.
It is complicated, and we know that treatment works better than incarcerating people.
Right.
And until that message really gets across to everybody, that it actually saves our community money, that you're working to rehabilitate somebody and have them be a positive part of your community, it's hard to get away from that criminal justice mindset.
Yep.
And not see that this is a disease,
Yep.
And the people that are suffering from this disease need our help and our support, not to be arrested.
Julia, what do you need? What can we do as a community to provide the adequate resources that this crisis requires right now?
That's a great question. What can we do as a community? I think Skye's hit on it somewhat about stigma. We need to, again, be embracing and working with people and understanding that they are struggling. They do have a disease.
Public education,
yes,
getting the word out, telling the stories. Yeah.
It's education, but it's also investing in things like that you don't always think are related to preventing substance abuse, like education and family supports and being able to provide training for jobs and secure housing. You know, some things we definitely see if somebody has an arrest related to a drug charge, that can impact their ability to be able to get a job, to be able to get housing, to be able to get scholarships to further their education. It can have a cumulative effect over their life, and that can be really damaging, and then just further, you know, further them into a cycle of relapse and not being able to have as successful of a recovery as they'd like. So what do we need? We need to reduce stigma. We need to invest more in prevention from an early age and across the life course. We need to be able to get people into treatment when they need it. We need to have naloxone on board, and probably other things that Skye would add to that.
Yeah, you know, I think that one of the interventions that I'm the most proud of is our recovery coaching programs, where people with that lived experience
through safe communities,
are reaching out and helping people that present to the hospital with an opioid use disorder, who are pregnant and have an opioid use disorder, or are being released from jail and have an opioid use disorder. And having that person just walk that path with you is so important. I also love to be able to give, I'd love to be able to give all your viewers something that they can do, so that they can be a part of fighting
this. If you can do it in 30 seconds, you can do it.
I can do it, all right. So I would really appreciate if everybody stopped using the word addict. Don't define me by my disease. I am defined by a lot more than that. So if you can start using the phrases, a person struggling with the disease of addiction, or a person in recovery, that makes a difference, and everybody can do that.
Disease, illness, right? Thank you both very much.
Thank you.
We're going to come back and wrap up For the Record right after this.
You can develop in the Army National Guard can give you an edge in the high-tech job market of tomorrow. The Guard offers career training to take advantage of your interests in science, technology, engineering, and mathematics. Gain practical experience with emerging technology and equipment that you can transfer to an exciting new field. Get a head start on your career while serving part-time and earning money to pay for college. Visit NationalGuard.com to learn about all of the STEM career opportunities available to you in the Army National Guard.
At Spectrum, we're always thinking forward. That's why we're increasing our starting internet speeds to 200 megabits per second. Enough bandwidth for all your devices today, plus whatever technology comes tomorrow. It's the fastest starting speed available for the price. No data caps, no speed throttling, no contracts. Just unlimited internet with double the speed, same great price. Only $29.99 a month when bundled. Spectrum Internet.
Isn't it about time you got the best sleep of your life? Then come discover the power of Tempur-Pedic sleep at Denver Mattress. With Tempur-Pedic's pressure-relieving comfort, you'll fall asleep faster, stay asleep longer, and wake up feeling refreshed. And right now, get a gift certificate for up to $300 along with 6 years no interest and free delivery. Get the best sleep of your life today at Denver Mattress, your Tempur-Pedic elite retailer.
I do all my shoe shopping at Rogan's because I know I'll find what I'm looking for and save. You can count on great service, a huge selection, the best name brands, the second pair is half price, and one more thing, a choice in how to save. I can get my second pair half price now, or just save my receipt and come back anytime and get my next pair at half price. Rogan's makes savings easy.
Selection, service, name brands, and the second pair is half price. Visit online at roganshoes.com.
My thanks to Julia Olsen and Skye Tikkanen, and to you for joining us. See you next week on For the Record.